So today I'm going to present my proposal, which is a title related about machine learning based prediction method in identifying skin cancer type by their microRNA expression profile. So this is prepared by me, Yap Zijian. Okay, you can call me Leo also. My matrix number is 222-02449. And then main supervisor is Dr. Eugene, and co-supervisor will be Dr. James and Dr. Lee from Codon Genomics. Oh yeah, because I got this project from the external company. So yeah, they will be my co-supervisors in helping me to doing the more technical part about machine learning. Okay, so how can I here? So introduction. Skin cancer. Skin cancer characterized by the abnormal growth of skin cells, primarily arises due to exposure to UV ray from the sun. Okay, this exposure induces DNA mutation, triggering uncontrolled proliferation of skin cells within the epidermis and form tumors. Right. So, skin cancer. Skin cancer, it can be categorized into 3 types. But if you want to put it into like 2 groups, you can put it into melanoma and non-melanoma. So melanoma is a kind of skin cancer that starts in the melanocytes. So melanocytes are cells that make the pigment that gives skin its color, and the pigment is called melanin. While the non-melanoma skin cancer refers to all the type of skin cancer that occurs in the skin, they are non-melanoma. Very straightforward. So the very common type that the cells might be becoming cancer is these squamous cells and basal cells. So we call them squamous carcinoma and basal cell carcinoma. Where's my... Yeah, so this is a typical picture of a melanoma. We can see a black spot here, and this is pictures of non-melanoma cancer, skin cancer. Okay, so a conventional diagnosis of skin cancer is via visual inspection or biopsies. So visual inspection, typically the dermatologist often will begin by visually inspecting the skin with, I believe now the technology used for visual inspection is called dermascope. Okay, and then other than that, also they will make biopsies. So if a suspicious lesion is found, a biopsy may be performed. And there are different types of biopsies, including shave, punch, and excisional biopsies. So why do I want to talk about this is because there are several challenges in skin cancer diagnosis. First, you have visual similarity. The different types of skin cancer can resemble benign lesion of each other. Okay, making accurate visual diagnosis is hard, okay, even for experienced doctors. And then overlapping features, some features associated with skin cancer, such as regular borders or color variation, can also be present in benign lesions and other skin conditions, leading to misdiagnosis. And variabilities, skin lesion can exhibit a wide range of appearance, making it difficult to establish a consistent diagnostic criteria. And last but not least is very subjective. So visual diagnosis relies on the experience of the dermatologist. So this may introduce variability and inconsistency in the diagnostic accuracies. So why I brought this is because I want to I want to solve this by using a machine learning method approach. So conventional method of skin cancer diagnosis often rely on visual inspections and examinations. So we can be subjective, time-consuming, and very prone to error. Okay. Therefore, in these studies, maybe I should make this a study. Sorry. Propose to use microRNA as a key biomarkers with the aid of machine learning. Okay, together with the public data that is already well established on internet in enhancing skin cancer diagnosis. So thereby, the main aim of this study is to explore the possibility of using machine learning as a prediction tools in identifying skin cancer types. So the objective here is to explore various machine learning as a prediction tool in diagnostic skin cancer type based on microRNA expression profile. So the specific objective will be, first, what I want to achieve from here is to, of course, when we got the data, we need to select what is the proper appropriate data to use lah. So objective one will be to select and reduce dimensionality of microRNA expression profile data, because this data is come from public data set. To select candidate mRNA expression profile as a biomarker in the 3 major skin cancer types. So we'll be focusing on melanoma, BSC, and SCC first lah. And then to develop, second objective is to develop, so based on this data, the second objective is to develop the predictive models. Okay, these are the models I propose to use by training a data set from the, oh yeah, sorry, from one, sorry, miss wrote here. Okay. So literature review. Okay. So microRNA are short non-coding single-stranded RNA molecule, typically 20 to 24 nucleotide long, that regulate gene expression at the post-transcriptional level by binding to mRNA. So they play a crucial role in the oncogenic activities by managing the mRNA expression during the cell cycles event. Okay. And so these are the online literatures, online papers that has been found. The microRNA, there's the role of microRNA changes in targeting the protein and causing the cancer cells lah. Right. So other thing is machine learning. Machine learning is a method to train computers by developing algorithms to serve the purpose of identifying patterns and making predictions with minimal external intervention based on the data and statistical model presented. So the reason I highlighted the supervised learning here is because in my studies, I'll be mainly focusing on supervised learning because we are dealing with more well-labeled data. It's not unlabeled data. So these are the examples, some examples of papers that has been proposed to use the machine learning in medical studies, particularly in cancers. So we can see one provide overview of machine learning used in a cancer prediction and prognosis, and then explore the use of artificial intelligence and machine learning in cancer imaging. And last but not least, something related to skin cancer is Ahmad in 2020, they discussed the various machine learning and deep learning techniques used for the classification of skin cancer through image processing. So my method, so the general workflow of this method is first we'll start with data mining, total of 452 skin cancer transcriptomic files from 448 cases are going to be extracted from the GDC data portal. And then after that, we'll do data cleaning. After we got the data, and then we need to analyze to identify the relevant microRNA expression data sets that are associated with a different type of skin cancer. And this is going to be performed by using Python with Scikit and R. And then third is data modeling. We will be, based on the data, we will train 5 predictive models from SVN, DTS, random forest, and linear regressions. Okay. And then the second things we do data validations. So the train models were going to be evaluated under 4 metrics. And then of course, the microRNA data set that will be validated using the online web server called GDAC. Okay. So we were comparing with this to validate the data. So the expected outcome is, of course, answering to the objective lah. The feature selection techniques will effectively identify a subset of microRNA expression data. And then the second thing is related to model performance. So after we got the predictive model, we will train them, and then hopefully we will identify the best model with superior performance, okay, based on the metrics we'll be using proposed in the methodology. So summary, to this stage, I'm still at proposal writing. And then due to the limited time frame of this project, the study is mainly focusing on mRNA expression profile of skin cancer tumor. So in the future, as I talked with the company also, they say that if we're able to complete these very fundamental things at a very short time frame, maybe we could proceed with the downstream process lah. But I'm still not sure yet and what to do on the downstream process. Yeah, so basically this is my Gantt chart, and then that's all. This is the reference. So I will end my presentation and move to Q&A session.
Yeah, thank you, Leo. So now I open for Q&A. So maybe Dr. Fatma, you have any question or suggestion?
Thank you, Dr. Sasi. Thank you, Leo. I think maybe Dr. Nius dulu, boleh kah? But Dr. Nius, I think you are most familiar with this. And then I'll continue with you.
Okay, no problem. Actually, I'm not that expert too in machine learning, but I have a few questions and maybe comments. Okay, thank you, Leo, for the presentation.
Dr.
Thank you, Dr. Sasi.
Sorry,
Alright,
Dr. Can you be louder a little bit?
Be louder. Okay. All right.
Yeah, raise the volume a little bit.
Okay. Thank you, Leo, for the presentations. Okay. I just want to ask you regarding the data, right? So you are only focusing on the transcriptome data, or you also include the microarray data as well in your analysis?
I'll be only focusing the transcriptomy data.
Okay. So it's not involving microarray data.
Yeah.
Okay, so when you validated, okay, you're saying that when you have the candidates for microRNA, right? So and then you try to validate it using the online web server, right?
Yeah.
So meaning that you just only targeted the microRNA that have been reported previously, right?
Yes.
So, but I think you probably get a new candidates during your analysis.
Oh yeah, that is also
So-
written in my proposal. Also, that will be the future work lah. Because given the limited time frame, there will be. I'm sure there's some ethics thing you need to apply, and so if you want to test it, bring it onto a reality in doing this. So that will be taking a longer time lah. So that's why I didn't include this.
Okay. Because I think it's if you have additional microRNA that could be potential for the future studies, could be new findings of the microRNA as a biomarkers, as despite just depend on what people already reported. Okay. Okay, so in machine learning, there are two approaches, right? Supervised and unsupervised. So you choose the supervised machine learning. So what are the difference between supervised, unsupervised, and why you choose the supervised approach for this study?
Okay, so the main difference between supervised learning and supervised learning, when we want to use them is that under a condition with whether you have a label data or not well labeled data. So what it means is label data is that this data you as already know is provided from coding from this source, right? Unlabeled data is something that is you're not sure with. So since we already have dealing with the data from the public data sets, it's already told us that this cancer leads to this microRNA expression. So this is a very well labeled data already. So it's unnecessary to use the unsupervised learning here.
Okay. So there are quite many it's like 5 algorithm that you're going to use, right? So is it all these 5 are all I mean, all the algorithm that we have for supervised learning. So you want to try all these supervised algorithms in your study?
Actually, that
Mhm.
is some wait the what I propose is the 5 data, right? I'm just saying the 5 like these predictive models, right? Am I getting your question right, Dr. Nick?
Yes, yes. You want to use 5 algorithms. I just wonder whether it is doable for the time frames. You have like 6 months. And I'm not sure whether it is doable to use all these 5 algorithms.
I
Whether you
think
have enough
is
time to do that.
I think it is doable because when I going into the company and asking them, they said that usually in transcriptomic studies are the work that takes a lot of time, the very time consuming is at the very beginning where you have to process the very raw data. And then for modeling, actually, if you already have the data, it's actually not that time consuming, like they say. But I'm still not sure, but they have give me a image saying that okay, I can complete this and I think I'm confident enough to do this.
Okay, okay. Perhaps I'm not sure. Perhaps maybe if you don't have too much time, you can choose 1 or 2 uh, uh, the algorithms. I'm not sure also what is the durations or the period of time that you're going to take for only 1 algorithm. Yeah. Yeah, I think that's all from me.
Hey, Dr. Fatma, any question?
Okay. Yep.
Thank you, Dr.
I'm here. Leo,
Yes,
you can hear me clearly, right?
yes.
Okay. So I think it's interesting that your project, I think this is the first, is it the first project, machine learning, presented in a proposal level at Inform? I don't
Yeah,
know.
I think so because
Um,
in terms of machine learning, I think so at inform level. Yeah,
yeah, I think this
probably.
is the first. Congratulations, Dr. Eugene, and also Leo to be the pioneer for this kind of work.
That's exaggerating.
Okay, so first of all, my question, when you have this, at the end of the day, this, I assume that this is a essay lah, essay. This kit or this whatever essay that you're going to develop. Your main aim is to what? To early diagnose skin cancer or to stratify the patient according to the subtype of skin cancer or what?
Okay, the main goal of this study is to increase the diagnostic accuracies of the skin cancer subtypes. Yeah, because as I mentioned before, the challenges in diagnosing for dermatologists to diagnose what type of skin cancer is this, it sometimes it can has a lot of factors affecting the diagnostic accuracy lah, like just now I mentioned. So to the studies now, what they are focusing is and here they are using the machine learning also in aiding the visual inspection. But how accurate is that? I'm not sure. According to a report, I think I mentioned in the proposal is about how many? I forgot. 60, 80, 80% something, if I'm not mistaken. But it still will cause error lah. So, and the thing with skin cancer is that um, you have to diagnose it early. Early diagnosis is very 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 important. So yeah, that's the rationale of why I raised this study, propose this
So,
study.
so you're saying that even though early diagnosis is important, but your study is to do subtyping or to subtype patients according to the type lah, according to the type of skin cancer.
Yeah, you can diagnose the skin cancer easily, but to put them into subtype is difficult. And if you are given a wrong result to a clinician, maybe they could provide wrong therapeutics, that treatments for use, and maybe it can lead to ineffective treatments.
Okay, so I think maybe you could highlight that in your introduction. When
Okay.
this subtyping is very important because different subtype would have different regime therapeutically.
Yeah.
So you should mention that lah. Why?
Mm.
So I think every time when we develop essay, we need to highlight what is it for. Is it for early diagnose when it comes to cancer lah? I don't know about infectious disease or other disease, but when it comes to cancer, you need to identify that do you want to do early diagnosis or you want to assist in therapy decision.
Okay.
Yeah. So in your case, you want to assist in therapy decision. So in doing that, you need to subtype the patient according to the subtype lah.
Yeah, but the aim is also to provide early diagnosis lah, because the survival rate for early diagnosis patient is relatively high.
Okay. So
Yeah.
coming to the early diagnosis, in your study, can you go to your methods?
Yep.
So when you are saying that you want to do early diagnosis, the methods, the one with the 3 point, the one with the 3, yeah, this one. So in this data mining, the total of 452 skin cancer and early diagnosis, usually you have a counter sample lah from normal.
Oh.
Okay. So usually that's the how do I say, that's common lah, because you need to have a reference and compare the patient.
Mm.
In your case here, you say for early diagnosis, but looking at the data that you show here, it's only coming from one group, which is from patient sahaja.
Oh.
So maybe, but this is at proposal level. I'm sure your understanding will expand a lot when you do this lah. So bear in mind that lah, and do discuss with your supervisor. And that's why you really need to ask whether this is for early screening or is it for subtyping according to type, subtype, to assist in therapy decision. Because these two are a whole lot different design in experiment if you were to do it lah.
Oh, okay. Now I get it. What you mean is that early diagnosis is to determine whether the
Yeah.
patients have cancer or not.
Yeah.
Is that what you're trying to address?
Okay. So my next question, when you put this 452 skin cancer from 458 cases, you already identify which data you want to use from the public database?
Yeah. This is already filtered. So
You
this-
already started lah.
yeah, I already got the data, but I'm still yet to proceed to number 2 in doing data cleaning. We still need to identify, because there's some others microRNA that is expression profile is not relevant to the skin cancer, so we still need to clean up all these.
I see. Okay. Okay, now the same question with Dr. Niu study lah. So you are not developing an algorithm. You are using or utilizing these 5 algorithm, and testing your sample, right?
Uh, wait. I think. Wait. Yeah, I think yes. Using these 5 machine
Yeah.
learning
So,
to develop a algorithm. Actually, the what I define algorithm is that the predictions tools that able to
Yeah.
help you to.
So you're not developing the tools, the algorithm, you don't do the coding, whatnot. You are using the one that people have used. You just put your data in and see whether it can differentiate between the subtype, kan?
Yeah. Yes.
Yeah. So that's what you do. So coming back to Dr. Nikyu's question, I think in the time, because you're not developing the algorithm, you are using the one that people have already developed, kan?
Yeah.
So there are 5 that you are testing. And my question, are you going to compare all these algorithm according to the parameter you mentioned the parameters, kan? The parameters that you're going to get
Yeah.
from
After using we got the models from these, so we
Can I
were.
see the parameters that you're going to
Yeah.
compare?
Here, the accuracy, F1
Yeah.
score, ROC curve, and confusion metrics.
So these are the parameters that you're going to extract out from the all 5 algorithm lah.
Yes.
And then you will come up with the best. You will show that, let's say, model number 5 is the best algorithm for this skin cancer that to answer the objective that you're going to do.
Yes.
Okay. Okay. I think my comment is this is a very good pioneer work involving machine learning at Inform. Congratulations. And I think that there's a bit here and there lah. My question regarding the what in the end, what do you want to use it for? Whether for early detection or to assist therapy decision, because these two design of experiment is different. So I think for to answer whether that or that, the design of experiment, I think Dr. Wei Kang from Modern Genomic will help you lah, and also Dr. Eugene as well will help you to design it lah. But overall, yeah, I think it looks sound. Are you going to position here at Inform or at Cordon?
Sorry. Me.
Yeah.
So in next semester, hopefully I will be in KL and doing in Codon Genomics.
Good. So you will be placed dengan Cordon lah for the project.
Yeah, I'll be going to their company with their aid, so and then help me to doing
Good.
machine learning.
I think that's our motivation lah, for you to be exposed with the industry punya experience. So good to hear that you're going to be there. I think good luck, Leo. This is a good project, good pioneer project at Inform.
Alright.
Looking forward to see the progress.
Okay, sure.
Okay.
Thank
Thank
you.
you.
Thank you very much, Dr. Farmer.
Okay, thank you, Dr. Fatma and Dr. Nick Hughes. Leo, please take notes all the concern raised by the evaluator. So with that, I'd like to end this session. Thank you. Thank you, everybody.
All right. Thank you, Dr. Sasi.